Hi, I'm Dr. Jan Jaffer, and this is Got Teeth, a patient-centric monthly podcast featuring local health experts. Hi, today I'm with Dr. Rabia Meghji, who is the owner of Docere Wellness and is a naturopathic doctor here in Calgary. Thanks for joining us, Rabia.
Thanks for having me.
So, we wanted to get started and talk a little bit about staying healthy. One of the things, I got 2 little kids, they're off to school now, and already in the first kind of week or 2, we're starting to see, kids getting sick, runny noses, a lot of stuff happens, and flu season's upcoming. And so we wanted to chat a little bit about, keeping our kids healthy, but then also keeping the adults healthy, because we've got work and we've got COVID and we've got so many different things going on. So let's just start with kids.
Yeah, absolutely. First thing to kind of keep in mind is that kids between ages 1 and 4 will get sick quite often, usually about 6 to 9 times. Sorry, parents. It's hard on the parents, but they're building their immune systems. So it's something that we kind of just got to get through. Most of the time, it's just runny noses, a little bit of fever, a little bit of cough. Doesn't require a lot of intervention. Of course, keep them really well hydrated, resting. Humidifiers are super helpful. You may want to just give them like soups and bone broths and things like that. They may not have a great appetite, but usually it doesn't require a lot of trips to the doctor for the most part. Where I do get concerned with kids, because I do have a very large pediatric base of patients, is that needing interventions for colds and flus. Like if kids are having prolonged coughs, or they're just not getting better, loss of appetite, maybe weight loss, just not recovering well. So then I may look for underlying immune issues like allergies, for example, or whether there's some nutritional gaps or something else going on, maybe some stress or whatever it is. We look deeper into maybe what's going on with that particular kid's health. But overall, they are going to get sick, and sometimes they'll pass it on to mom and dad.
Okay. So as we get slightly older, so we know that the little kids are, again, building immunity, they're going to be sick. We're going to start to get a little older into these, 6 to 10, grade 1, 2, elementary. What are we doing? What can we do to help keep our kids healthier? Because again, inevitably they're going to get sick. That's natural, and it's a good thing necessarily, because like you said, building immunity. But what can we do to keep our kids healthier? And let's start with food. We can get to supplements maybe a little bit later, but in terms of food or sleeping or water, is there things that you're recommending for our kids to be doing?
Absolutely. Kids will need 12 to 14 hours sleep. I always put that as a top priority. So making that definitely, high priority. Hydration, super important. They should be drinking plenty of water throughout the day, depending on their size. 3-4 cups of water for a school age kid is pretty average. And then of course, nutrition, eating the rainbow, focusing on good quality proteins, organic when possible. I always say eat in the season. So trying to eat the foods that are, fresh for us. There are lots of fruits in the summer, but more apples, pears, berries, things like that are more available to us in the winter. Those are the main things we want to do, nutrition, sleep, hydration. Those are the keys we want to always focus on with our kids. And then, we can always add a few new extra things if we need to. Vitamin D is a key one, right? It may be why we see more flus and colds in that time of year. We spend more time out inside. And so definitely a little bit of vitamin D is helpful. Getting outside is nice, but of course we have pretty long and hard winters here. So that would be one of the first things I would also look at, is starting with a little bit of vitamin D for everyone in the family.
Yeah, and that's important for everybody, right?
Yes.
Not just the kids, it's probably, important for the adults as well. I know there's a lot of people who say, how much do you take? Do you have a recommendation, or do you?
I do, yeah. So for adults, 2,000, 2,500 units is good. For kids, 800 to 1,000 is enough. And the little babies, especially the breastfeeding ones, need to take at least 400 units.
Okay, so you start all the way from breastfeeding,
Yes.
And then obviously the adults are doing that, and that's on a daily basis.
Absolutely.
Okay. Does nutrition or any of the things that you recommend change as people get into kind of adolescence and or even adults? Is there much different in the recommendations?
I do think adults maybe could consider a little bit more, and even school-age kids, Probiotics is a good one. That one's a pretty safe bet and quite helpful. It's good for digestion, which, remember, 75 to 85% of our entire immune system is in our gut. So supporting digestion is really helpful. So I really like a probiotic also in the wintertime. So vitamin D, a good probiotic, and we can potentially add a little bit of vitamin C and zinc also for adults, especially if they are maybe exposed a lot, teachers and, healthcare workers and people out in the community who are getting a lot of cold and flu exposure. I think a little bit of vitamin C, 1,000 units, maybe 25 to 30 milligrams of zinc is also a good idea.
Okay, great.
Yeah.
And so just starting to add these in on a daily basis, is there any recommendation when you're taking them or how you're taking them, or does it really matter?
You can take, vitamin D should always be taken with food, any meal of the day. Same with the probiotic. Zinc also should be taken with food. Vitamin C can be taken on an empty stomach. But yeah, a daily regimen. Sometimes these things come together. There's one really good product for kids that I have that's a probiotic with C and D all together. So sometimes you can get something like that, make it a little bit easier, taking less things. But yeah, that's a really good place to start. And like I said, if somebody's getting sick often, an adult should maybe only get sick once or twice a year, school-age kids maybe 3 to 4 times, then maybe to talk to your doctor, get some lab work done, and maybe see if there's any underlying issues. It would be lovely if we could all test vitamin D, but doctors often don't. You can do a private vitamin D test, but taking vitamin D is a safe bet regardless of a lab test.
Okay. And I know, and this one sometimes gets a little contentious too, is like, what is a good quality, type of, vitamin D or probiotic and the rest. And I know, obviously there's stuff that you would have at your clinic that would be different than maybe what people are finding out there.
Right.
Without saying, hey, we have to come and see you to buy this. Like how can we look at, what's out there and know that's something that we should kind of stay away from and maybe lean towards? Because I know there's just so many options out there, and
for sure,
some of them are not that great necessarily as what's in the public.
Yeah, for sure. And I definitely give patients lots of options of where to buy. The good thing is vitamin D is fairly the same everywhere. It's all from the same source as a sheep's lanolin, unless you're vegan, and then you're going to buy a vegan vitamin D, which is from lichen. So they're all otherwise the same. They're all D3, unless prescribed by a doctor, like a high dose would be a D2, but everything you buy on the shelf is a D3. So it's pretty well the same thing. When it comes to probiotics, I look for a few things, whether it's like refrigerated, a higher dose should usually be refrigerated, and also the source of it. So people who have dairy sensitivities, I tell them make sure to look for a dairy-free probiotic, and also look that it has a good enough potency that it's going to be actually helpful. And then there are of course some good brands that I tend to recommend, both retail and professional. So yeah, we definitely have a lot of choices, and a doctor can often help with what good brands are available.
Okay, so we have a kid that's gotten sick. I mean, again, rest, water. Is there anything else that you're recommending for, to get you back and healthy? Is there, obviously you have, coming from an Indian family, it's like, put some turmeric and some milk. And is there anything that you recommend to help, get kids or ourselves healthy, or do we just stick with the normal, vitamins and water?
Thankfully, we have many things in our medicine cabinet. So let's start with honey, right? Over the age of 1, honey is a great treatment for cough and cold. I love saltwater gargling for any kind of instance of sore throat, so you can start doing that. Again, the humidifier, super helpful. You want to have that running all the time when there's cough and congestion. Saline rinsing is another really good one. Often people do have one of those on hand, or you can even just do a steam. So if you don't want to run the water all the way through, you can put a few drops of eucalyptus, or just do a plain steam with a towel over your head. When you're doing saline rinsing, make sure it's distilled water. You can get an infection if you're just using tap water. So don't use tap water in your neti pot or your saline rinse. Chicken noodle soup, right? Good old chicken noodle soup. Lots of onions and garlic if you can hide it in there for kids. It's a great option. I mentioned earlier bone broth, so I'll often make a soup with the bone broth because it's got extra nutrients and protein and minerals often when we don't feel very hungry. A bone broth based chicken noodle soup can be really nutritious and very hydrating as well. So yeah, there's lots of things in our kitchens that we can definitely use.
That's awesome. That's actually a lot of great information. Is there anything else that you want to add that people should be aware of, or anything that we would have missed to help stay healthy?
Well, a couple things, maybe, when to seek out a doctor's help, right? So I think if you're experiencing symptoms that are getting worse, then it doesn't hurt to call 811 HealthLink and talk to a nurse and have them direct you either to urgent care or to ER. So if you're having rapid heartbeat, you're feeling faint, your symptoms are worsening, shortness of breath is a big one. You may need to do a COVID test or whatever. So definitely don't hesitate to reach out for help if it's more than just a little, cold or something that you can handle at home. Remember, colds are milder. Flus often have body aches, headaches, more high fevers and things like that. So, cold we can get through. Most of the time flus we can get through, but again, if some of those severe symptoms are happening, don't hesitate to call HealthLink or call your doctor's office to book an appointment.
Great. Well, thank you for this information. This was great. A lot of good information, things that we can, like you said, we just have them in our house. So things that can help us get better, quickly at home. So hopefully people will be able to stay healthy during this flu season. Again, it's going to get a little cold out there, and the vitamin D is a great example of a way that we can help fight some of that. So thank you for your time.
Yeah, thanks for having me.
Awesome.